Saurabh, please start. Recording start.
Okay. Sure. Very good evening, every participant. This is the wonderful evening that we have come together here to learn something new. Myself, Saurabh Sandilya. I am in charge of academics as well as communication at My Rehab Academy. I am very, very thankful to my CEO, Dr. Sumanjit Sarma, and CFO, Dr. Diwakar. He'll be joining in few minutes from now. And Dr. Kalimullah, who has already joined, I believe, that he has given opportunity to me to give the inaugural speech. My Rehab Academy is a platform which connects the physical therapist, either it's a graduate, fresh graduates or students, to the best of instructors for upgrading their skills, knowledge, and of course, the, the connectivity in the amazing way in the physical therapy field. Since we have been conducting our physical conferences everywhere in the country, and we in in the lockdown we went right from physical to digital. That means we never stopped our work, and ever since we became digital, we have conducted more than 500 hours of class. In this 500 hours of class, there are e-conferences, there are normal e-virtual classes, as well as there are some classes about the awareness program. What I want to say today, that it's a like feeling of very good search, that My Rehab Academy has been selected by India Business Award as one of the best brand for conducting e-conferences for this year. Our brand has been viral. You can find us everywhere across Facebook, and our process is very, very smooth. And I'm very, very happy to announce that many of my candidates have been joining regularly in different kind of web program. Almost every weekend we have, and then of course in the lockdown we were having even on the weekdays. Even I was taking classes for cardio as well as for electrotherapy. And our instructors, right from the India to America, I can tell you, right from Middle East to Africa, we have more than 200 instructors who are internationally recognized. Few of the big names like Craig Smith, Barry Gage, these all are the people, Jackie ma'am, these all are the people you must have been hearing through your friends, through the social media, through different platforms. They are extraordinary. These are the people who have been representing their country in Olympic Games, not just once, maybe more than 5 or 6 times. They are the people who have been representing their country for Commonwealth Games. They are the people who have been cricket coach for India and Africa, or maybe another many more countries. So what I mean to say you, that My Rehab Academy brings the best to you, that too at quite reasonable cost. My dear friends, we are having like once or twice in a month the free programs. In month of June, on eve of International Yoga Day, we have tomorrow also we have the program Therapeutic Yoga for all the ages. We are keeping, in amid corona pandemic lockdown, we are keeping the courses on diet, immunity boosting diet. You can find those links in our chat option or in the break. My CEO will give you the link. You can join that, because My Rehab Academy has realized that it is not just physical therapy. We are going to touch lives everywhere in the country. In the whole country, right from the north to south, east to west, we are touching lives. We are not just limited to physical therapy anymore. Now we are touching lives right from villages to mega cities in different way. I mean to say that we are educating people for lifestyle disorders. We are bringing the best of instructors to give the better information, to give the latest update about the programs, whatever they are talking. I mean to say, as I told you today, today Dr. Dharmesh will be giving you insight about the ergonomics. Tomorrow, Dr. Diwakar will be giving therapeutic yoga for all ages. That is his theme of lecture. Then you'll be getting lecture for the immunity boosting program immunity booster diets. That program is by Dr. Manjunath, and these all programs are free of cost. We are coming in the month of July for the depression based class. I mean, how to reduce the depression, what is depression, because we have realized that mental health matters, and mental health is one of the most important. Look, uh, dear Janice, look what happened. We may have thousands of followers on social media, but are we really together? We are not together. I mean, we are not together physically. What we were used to happen, I mean, what kind of friendship we used to share earlier, even though with that we have 1,000 plus followers, or even we have more than 10,000 people in contact, we are not so much engaged with them. Why it is happening? So how to deal depression, that the class is coming up in the July. I would request every participant to please join and see how, why I'm saying you today mental health matters. We are the people at My Rehab Academy. We are committed to our humanity, to the nation, that we will not we will educate people in such a way that they don't go for the suicide, they don't go for the depression. Now, I won't be taking more time because it was due to my mistake, that technical part I could not do. Sorry, CEO sir, I made you delay for about 7 minutes. What my Rehab Academy has an average delay of till now for about 5 minutes, I believe, 5 or 5.5 minutes. Dr. Dharmesh Conti, he is joining you in a few minutes. He is the wonderful presenter for ergonomics as well as few of the clinical conditions. He practices in Vadodara, and his presentation has touched 1,000 plus lives, and he has been able to change the lives of 1,000 plus people through his expertise in ergonomic classes. Dr. Dharmesh, kindly give your insight, and you can share your screen with your slides and enlighten us, all of us, with the ergonomics.
Yeah,
Ergonomics amid Corona lockdown. Thank you so much, Dr. Dharmesh. Please.
yeah. Thank you, Mr. Saurav, for your wonderful speech and also for your thanking words.
Thank you, sir.
Thank you. Okay, so can I start the session?
Just 1 second.
Okay.
Just 1 sec, sir.
Yes, sir. Please start.
Yes. So good evening to everyone. My name is Dr. Dharmesh, Contractor. So today's class is on ergonomics advice for working at home. So why I have given the coronavirus ergonomic, please next slide, please. So why I have given the coronavirus ergonomics advice for working at home? Because due to coronavirus, many people are into pandemic area, and due to this pandemic situation, many people are able to work from the home itself. So for that purpose only, I have given the term coronavirus. Next slide. Okay. So you might be experiencing like seen in the pictures. How many of you are suffering from this kind of pain and aches, and how many of you are just maintaining this kind of posture? Please mention the comment box.
One sir, one poll we can do it this time.
Yes, yes.
1 second. Yeah. So everyone, please, you can choose your listings if anyone has.
Yeah, if anyone has any kind of symptoms like low back pain or neck pain, or he or she is maintaining such and such posture during the work, you can mention in your comment box.
Or no, no, in the poll only you can click.
Okay.
You have another 30 seconds. Yeah, that's fine. So I am ending the poll. 1 second. And
10 seconds you give, sir, I think. Okay, sir.
and this is the result. You can see neck pain has 49%, upper back is 26%, and wrist pain you can see 9%. And Sarabji, you can tell.
Foot pain is about 7%, leg pain is about 7%, thigh pain is 4%, and wrist pain also, as sir told, 9%. And down one, since how many days you are suffering from this pain? So 42% says that last less than 5 days, more than 10 days about 28%, and more than a month it's strikingly 32%. Any
So
painkiller?
that's within 5 days the pain is more actually. For
Yes,
42% people are suffering from last 5 days. Uh,
yes.
Another thing, the first one, are you suffering from any pain? So neck pain is more, 49% it's showing.
That shows that a lot of work from home is going on.
And the low back pain is 40%.
Yeah. And
So
then third question, if you can see any painkiller you are taking, I'm
no,
very happy to say that 98% are not taking any painkiller. Very good, wonderful. And a lot of stress in your job. Yeah, roughly saying 40% yes and 60% no. I think this is something, how do we perceive our work? So yeah,
yeah.
yes sir. Please
Okay,
proceed,
we'll
sir.
stop the share now. 1 second.
Yeah,
Yes.
poll has been closed.
Yeah.
Good.
And these
So,
things are quite confidential. It won't be shared anywhere, any platform. So don't be worried at all, dear participants. Nothing to be worried about it.
okay. So as I see in the poll, like please the next slide. As I see in the poll, most of the patients are suffering from the neck pain, and the low back pain, right? So why such and such is happening? I'll discuss in my coming slides. Okay, so you will better understand what, and I am happy to hear that no one is, hardly anyone is taking any painkillers or medications. Okay, I'm happy to hear that. So how you can control, how you can eradicate this 2% also, and make it 100%, that I will explain in my coming slides. Okay, next slide please. Okay. So today's agenda is on what is ergonomics, what is the definition of ergonomics, what is how you can implement those uh, ergonomical equations in your practice. What is MSDs? MSDs are also known as musculoskeletal disorders. Okay, musculoskeletal disorder in the sense, the person who was having low back pain or the neck pain or the pain or ache anywhere in the body are considered as a musculoskeletal disorder in a terms of medical condition. Okay, then agenda is like charm of freelancing. How many are more passionate to work for like a freelancer? What are the disadvantages of working as a freelancer? What are the improvement strategies ergonomically? Do's and don't, and at last summary. This is the agenda of today's class. Next slide please. Okay, so first of all, coming to the what is ergonomics. Okay, so ergonomic, it deals with the worker, task, job, and the environment. Okay, it doesn't deal only with the one part of the thing. like it deals the three aspects: worker, what work he or she is doing, under what environment. Worker in the sense whether he or she is there, what work he or she is doing, and under what environment. Okay. So goal of the ergonomic is to design the job to fit the worker, not the worker to fit the job. Okay. Next slide, please. Okay. So ergonomic, the term itself, it reflects that ergon means a work and nomics means the law. So ergonomics is a it defines that the laws of the work. Okay. So yeah. So due to this pandemic area, many people are about to work in their home itself and making the home as an office. Okay. This means more and more people are working at the different locations other than their business offices. Not everyone are aware like what is the correct posture to be maintained, what is the correct uh, what is the correct thing they can able to gain during the working area. So none of all, there might be a lot of information available online as well as on Google also. If you just type ergonomic posture, you might get n number of information. But what is correct information according to OSHA guidelines, that I'll be discussing today in my slide. What is the correct way of improving your posture? What is the correct way of improving your posture, your wrong habits, that I'll be explaining in my coming slide. Next. Yeah. So for majority of individuals who are going to be working from home for the first time, the suppose a person is of manager level or supervisor level, that persons are working from the home. They are habituated to work from the home. But due to this pandemic area, a worker, sim, a simple worker working in an office is able, he is bound to work from the home itself directly. Okay. So he is not used to working from the home directly. Instead, he will be forced to work from the home because of this pandemic area. Okay. So he is not having a proper chair or proper desk, but he may not able to maintain his posture properly. So due to the lack of the adjustment of the chair or any other part of the working area, or he may not having a proper workstation area. So there are some simple steps to take care about how to optimize your posture and improve your quality of work and discomfort. Next, please. Okay. Charm of freelancing. What does it signify? Like the person like who are more fond of working from the home, they will feel very happy because there is a no stress, like there is zero stress from their supervisor or from the boss. There is flexible time. In the flexible time they can work from the home itself. Okay. And you don't have to travel or go to your office on a particular time and should log in and all. You can have more time for leisure activity and endeavors you want to pursue. Next. All you need to have this proper ergonomical posture. Like you need to have proper connection of your laptop or a desktop or your computer, a reliable internet connection, proper ergonomical designed workstation, and ergonomical products based on your requirement. Next. Okay. There are some disadvantages working from the home, like uh, there are many risks. As I can see in the poll, many of you are suffering from the neck pain and the low back pain. Okay. So why these two common areas are happening in the human body working from the home? Okay. So I'll be discussing my coming slide. So firstly, health risk bound, even if the comfort at your home. Why? Okay. So why it is happening? If you are very comfortable working from the home, so why then also you are suffering from eye strain, low back pain, neck pain, carpal tunnel syndrome. Carpal tunnel syndrome is a medical condition where you can see in the picture I have shown that a person is using a mouse, right? So forcefully he is putting his wrist under pressure and clicking the mouse. So that leads to compression of the nerve which is passing beneath the wrist joint. Okay, so that compression of the nerve will have the tingling or the numbness or the pain sensation on the finger. So that is called a carpal tunnel syndrome. Next, please. Okay. So how you can improve your work working from the home? Like if you are many of you, if you just Google it and search what is the best gadgets available online. Okay, so if you just find out any of the gadgets available online, okay, and if you just keep an order because of this pandemic area, Amazon branded that much big brand also not delivering the products on the time due to the pandemic and due to coronavirus happening all over the world. So if you just order also, then it's all you may not get the product on the time or may not get even. Okay. Workers are going to need to see what they have available in their own home. Okay, you need to be very precisely, and you need to have a look like whatever objects are with you, just you can utilize those things and or objects, and you can make your home as a office. I will explain in my coming slides how you can utilize the home as an office. Next, please. Okay. These are some different locations I have shared. I have shown in my slides, like a person working from the kitchen itself, a person working on the tablet, a person who is working on is sitting on the couch. Though they are not a perfect ergonomically posture, they cannot maintain the proper ergonomical posture, then also you can manage it somehow. Next, please. Yeah. So what is the ideal setup? Like the person who are fond of sitting and working, you can see in the picture, the person is sitting on the chair. This is the ideal way of sitting on the chair and working in front of a desktop. The person who are fond of standing and working, that also I have shown in the picture. In the Google company, Google, I visited one of the company in the Bangalore area that's called Google, where the employees are fond of standing and working most of the time. They rarely sit on the chair and work because they are aware like what is the proper posture and how to eradicate the wrong posture and all. So my advice is to stand and work from more than the sitting arrangement. Next, please. Sitting on a couch. Okay. So sitting on a couch also, it doesn't have proper ergonomical correct posture, but you can manage it somehow. Somehow you can manage it like proper neck vision will be there, proper type arm and upper arm and lower arm will be there, neck position will be all right, but that differs the leg position. Okay, leg position and the typing area. There, these two area will it will have the pain and ache. The couch and the working from the couch and the bed is not at all advisable. But if you don't have any possibility, you can obtain it. You can avail it, like you can avail this kind of posture. Like if you have use of couch, use a table for a computer, sit upright, use a pillow or other support. Do not use your laptop in bed. Next. Using a tablet and a keyboard. The person who doesn't have a computer or a workstation, he or she can use a tablet also. But if you are using a tablet, same precautions you have to take. Like I will explain in my coming slide what is the perfect ergonomical posture you can maintain during your work level. Okay, using a tablet, the vision, first of all, it comes a vision, like the neck position. Why the neck position is going wrong? Because you are bending your neck or just peeping inside the screen and not maintaining one hand distance while working. So because of that particular reason, the neck strain or the pain is happening on the cervical area more. Next, please. A person who is attending more only phone calls, like in 24 hours, 15 hours, he's attending the phone call. So in the market, like many gadgets are available, as it is a digitized area. Many gadgets are available, like Bluetooth headsets are available in the market, and wired or wireless headphones are available. Okay, so if you are just connecting your Bluetooth device with your headphone, or you can at least keep your cervical or the neck portion straight instead of bending your neck, okay, to attend the phone calls. Leave hand free to type, write notes, etc. So you can do a dual task at a time. You can attend the phone call as well as you can type and the on the phones as well. Next, please. So what is the proper laptop ergonomics? For the desktop ergonomics and for the laptop ergonomics, both ergonomics are, I will be explaining my slides. What is the correct way of using your laptop at your home or in the office, and for the desktop in your home or in your office. The first one is laptop ergonomics. So while using your laptop, you need to, most of people are just bending their neck to visualize the screen, because laptop height is only 9 to 10 inch from the table height, and a desktop height is almost 16 inch from the table height. So just imagine like 16 inch and 9 inch. So if the height of the inch decreases, definitely you will keep your uh, eyes and go inside the screen and bend your neck. You will not take a backrest support of the chair. So these are some common areas we need to focus on while using your laptop. Okay. So
I'll
and for,
play
yeah,
the video.
no, not now. I'll tell you.
Okay.
Okay. So while using your laptop, you need to bend your neck. You need to bend your back. Okay. The third thing, the hand portion will go wrong. Your upper arm and lower arm, see in the first picture, the upper arm and lower arm, it is not into 90 degree. Okay, so the upper arm and low, the shoulder pain will come. Apart from shoulder pain, low back pain and the neck pain will be arising shortly. So in order to correct that, in the second picture I have shown the correct way. Like the person has elevated the height of the laptop, so it's almost able to uh, 90 degree of the vision level. The upper arm and lower arm is almost 90 degree, and the leg position is almost 90 degree, and the person is able to sit straight on the chair. So all thing is maintained. The one arm distance is maintained, the back support is maintained, the upper arm and lower arm 90 degree is maintained, and the leg position of the upper leg and lower leg 90 degree is maintained, and the person can able to rest his feet on the floor. Or else, if it is possible to connect a laptop to a bigger screen, in the sense a docking station, you can connect your bigger screen, your laptop screen, to a docking station and visualize the your working screen on a bigger screen. You can have that option also. Okay, you can play that video. This video I'll be showing, like it will show the proper ergonomical laptop ergonomics, how you can use a laptop ergonomics video I'll be showing. Can you please unmute the audio, please? Because no sound is coming.
Seconds.
Recording. Don't reach out for the mouse. Okay. Is the height correct for you? I don't think so. Is it correct? Monitor height? Yeah. Yeah? Something is there inside that?
Not that one.
Okay, good. Thank you. So this is how you can use your laptop as a desktop, and also you can use your home gadgets. You can, if you are available, if it is there in your home, you can use those all small, utilize your small things, and you can make use of those things. Okay, and while typing, you don't have to just take a wrist support, and just you don't have to move your fingers. You have to move your whole upper arm and the lower arm for typing. Okay. If you want to type, just press control on one side, and if you want to type letter A, so both are very far from each other. So try to utilize both the hands finger to type individual letters. Okay, next please.
One second.
So next comes kitchen counter as a standing desk. Okay, the person who is not having any working area, and he's fond of standing and working, then he can use the kitchen as a desktop working station. Like if the person is having tall height, okay, so then he can wear some shoes, or he can elevate the foot area to reduce the low back fatigue if he is a smaller height. If he is a taller height, okay, or a shorter height, you can use a stool, and you can stand on either leg simultaneously, and you can work, and other adjustment are same like a desktop ergonomics. Here, working from the kitchen, or from the sitting on a couch, or the previously which I showed a slide, like a person is working on kitchen, or sitting on a couch, or sitting working on a tablet. These are not a proper ergonomical correct posture. But then also, if you don't have any option, you can go for these changes, small changes. Next please. Okay. So this picture shows that the person is seeing on his left side and typing frequently. So a person is if he or she is sitting like this and working in a diagonal manner, definitely there will be chances of pain on the left side of the neck, pain on the upper shoulder, and the pain may relate to the lower back very soon, because he will be definitely tilting his back on the uh, left side because of the usage of the screen on the left side. Okay, so in order to correct this posture, we need to keep his screen and the keyboard in front of his eye. Instead of keeping on the left side, he need to keep on the straight way where the cactus has been kept. He need to keep that screen in front of his eye level, straight, parallel to his eye level, instead of right or left side. So this will prevent his neck strain and the low back pain and the upper arm and lower hand pain. Okay. So these are desktop ergonomics which I'm explaining you. In the desktop ergonomics, the first and the foremost thing, the chair height. Okay. So as you all aware, like every individual are having different heights and weight. So how I can able to identify whether the particular chair is suitable according to my height or not. Suppose if I take an office as an example. Okay. So if I have observed that in IT companies in an office, if you just keep one chair and in your desk area, other day that chair won't be found. Someone else might have taken your chair and you might be using that particular chair. So next day you will be surprisingly using the new chair. So the height adjustment which you have made it today, you might not get it tomorrow. So you have to again arrange it, and you first of all you are not aware like what is the correct way of making the chair height according to your height level, right? So I'll be telling you what is the correct, how you can correct the chair height. Okay, like keep whichever chair you might be using, whether if you are using a increasing height adjustable height chair, or you are using a standard chair with non-adjustable height, whichever chair you are using, just go nearby to the chair. Okay, stand straight and touch your knees to the edge of the chair. Front edge of the chair should be touched. If the knees are touching on the edge of the chair, that shows that your height is according to the chair height. You need not have to increase your chair height up and down. You can utilize that particular chair and sit on the chair, and I'm sure that 100% that you won't be getting any leg strain or the back strain by adjusting your chair height like this. Okay, so I hope you all get. I'll be explaining my summary session again. So next comes keyboard mouse. Oh no, previous slide. Next comes the keyboard and the mouse surface. Okay, so always you need to keep your keyboard and a mouse side to side. You do not have to have observed in many of the companies, a person is using a keyboard and a mouse, keeping his keyboard on the keyboard tray and keeping his mouse on the desktop area, on the workstation area. When I'm asking the person why he's doing like that, he will tell that I'm not used to frequently type. So his job is mostly of the frequently of the clicking area. Like he's not used to font of the typing area. So you might be using on the uh, uh, work desktop area. So that should not be happen. Whichever, if you are using your mouse and a keyboard, always see to that you should keep neck to neck, very side by side. Now third point comes the monitor distance. Okay, there should be always one arm distance. You can straight your arm and check whether it is one arm distance from your eye level, or the red color which I have shown in the figure that indicates the vision one arm level. It should be there between your eye level and your screen height. Okay, if it is more or less, you can push back your screen, or you can make your screen or nearby to your body in order to reduce or increase the eye vision level. Fourth comes the writing surface height. It is same like the keyboard and the mouse surface height. It will be same like for the writing surface height. It is both one and the same. Okay. The monitor height, it should be 29 to 30 inch from the ground level. Okay, so almost all of the desktop working station in the companies, their tables are of 29 to 30 inch from the ground level. So this, if you want to implement all this, if you are making your home as your office, and if you are just implementing this sort of tactics and the advices, I'm sure none of you will have the pain or ache. So if you have seen in the poll that many of you are having a neck pain and the back pain, I'm sure that because of this all arrangement only, you are having this kind of neck pain or a back pain. So if you just correct this kind of posture in ergonomically, I'm sure you will be not having such pain. And next, please. So these three picture have shown. Okay, there is one task I'm giving you. You need to select any of these three picture among which is the correct way, correct posture. Posture 1, 2, or 3. You can chat in your, you can type in your comment box. I'm just waiting for you for 5 minutes.
Over to Saurabh.
Please mention that which is the correct posture. Type your number.
Okay, Dharmesh.
Good, good, very good. So I think all of you are aware regarding the neck posture. So all of you have mentioned the correct answer. That's the number 2 position, where there is some bundles of nerve which are passing from the neck area, and that's called thoracic outlet syndrome, where TOS we call in the medical condition, where the person is having pain in and impingement on the nerves vessels passing from the neck area and passing from the shoulder area. So first picture it shows the uh, forward neck posture. Okay, second picture is a normal posture. That's good. Good answers to all of you. And third position is the rounded shoulder, where the upper back goes into rounded position, and due to that rounded position, the now compression of the nerves are coming. Good. Thank you. Thank you all for the answering. Next, please. Okay. Get dedicated workspace. As I told you that if one person is having a particular chair, he has after a lot of difficulty, he has managed to get a proper chair in his working station. Okay. After a lot of difficulty, we have got a chair from a working station. He has arranged the height, all the thing he has arranged, and second day he will be that chair is misplacing from his place. So most of the employees are keeping writing or tagging the chair, like he or she will tag his or name or the alphabet on the chair, or he or she will mark a chair by his name, and he will next day when someone goes misplaces the chair, he can easily find that particular chair. So like that, I have observed many of the employees are uh, having this trick. Okay. So in order to have, in order to misplace the chair, my question is like, why you are worrying of one chair or itself? You can use any of the chair. Just adjust your chair height according to your height level, and you can utilize that particular chair. Okay. Second thing about the chair, like many of I have observed that many of the employees are complaining like they are not having a proper chair. Whenever I visited companies, employees are complaining of the chair. At the 98% of the employee will complain of the chair. Why? Because they are, first of all, they are not aware, or they might be lacking of the knowledge how they can make use of their chair properly in your working. So as I told you, like how you can check the chair height according to your height, you can make the chair height first thing according to your height, sit on the chair and work. Okay. Second thing, if the backrest, okay, if the backrest of the chair is been tilting, there is a knob available, like many different chairs are available in the market. So many different, whether some chairs are having a right side, some chairs are having knob on the left side. So I cannot right or left side. Just you can may have a look on your chair whether the one knob will be there. If you just lock that knob, it will help to prevent your rocking of the chair. Rocking of the chair in the sense if it will prevent your back tilting of your backrest. Okay, so always you need to keep your backrest locked, okay, in order to prevent the rocking of your back, or in order to prevent the low back pain. Okay, if you are just keeping your backrest locked and keeping your chair straight, I'm sure that 92 to 98% of your pain will go in 1 or 2 days itself. So next comes a monitor. What is the use of the monitor? How you can use your monitor? Like if you are using a laptop, as I told you, if you are using a laptop, you need to use the separate keyboard. Okay, because if you are using a laptop laptop keyboard, definitely the upper arm and the lower arm position will not be in a 90-degree angle. It will be less than 90-degree angle. Okay, so in order to keep that 90-degree angle, you need to attach an external keyboard to the laptop and use that keyboard as a keyboard, external keyboard, and you can type on that. Same way for the mouse. Instead of dragging your fingers on your mouse pad, connect an external device as a mouse, and you can you can keep your laptop keyboard and a mouse side by side.
Yes, sir. What happened?
Yeah, my voice is coming okay?
Yeah, absolutely fine.
So you can use your keyboard and a mouse next to next, and you can click on your mouse, and you make use of the keyboard by attaching to your laptop screen. Okay. So next comes the chair and the mouse. As I explained, chair. Okay. If you are using a chair at your home, the previously which I have told you, it's in your office, and the one which I'm telling you, it's for your home. If you're using any kind of chair, or you can use a cushion or a pillow, you can keep on the lower back area, and you can adjust your chair and sit upright. You do not have to lean forward. Just see to that you are taking full backrest support and sitting properly. Okay, so that will 98% will reduce your pain and aches coming on the lower back area, because in the poll I have seen that most of the people are having a lower back area pain or the neck pain. So these two areas are the more common areas where there are more pain or ache happening, because these two areas are there in our body where there are curvatures coming. First of all, the cervical curvature, and the second curvature is happening on the lumbar curvature, lower back curvature. So wherever the curvatures are coming in our body, the angulation will happen, and the pain and ache will develop on the particular curvature itself. Okay. Next, please.
So one poll will do now. One simple poll. Yeah. So everyone request to select the things whatever you can see in the screen. Okay, so I'm ending the poll. yeah, you can see the results, sir.
Okay.
How many are working from home or professional? It is 57% from working from home.
Okay.
And second is then how much time they are spending in front of the laptop. It's less than 2 hours is 53%.
Mhm.
More than 4 hours 29%, and more than 6 hours is less. That means less than 2 hours is more.
Okay.
And so next question: are you using proper workstation, like proper ergonomic chair with proper armrest? So no, mostly 45% is saying no.
Okay.
Uh, and it's saying I do my office work by putting the laptop on my bed. 25% are putting laptop on the bed only. You can see. And next is I do my office laptop in the dining table. Okay, some people are putting the laptop in the dining table as well. And so the mostly is no proper workstation people are maintaining.
Okay.
So last question is how frequently they are taking breaks in between the continuous works. So more than every 1 hour people are taking. 41% is telling every 1 hour. So that is that you have to tell, sir. Every 1 hour has to take, or every 30 minutes,
Okay.
or you can see the things in the slide. 1 second, sir. Just 1 sec. Okay, so I'm stopping the share this, and
Yes. So as I have told you, like how you can use your phone as your, if you want to make a phone call, or else if you are making a business call, or for longer hour, if you are fond of using your phone, you can always attach a headset or a speaker to your phone. Okay, you don't have to bend your neck to the one side and kink your nose and the blood vessels. Instead of that, you can attach your headset or the phone, or headset or the speaker to your phone to prevent your neck pain and the shoulder pain. Next slide. Next. Okay. So ergonomic tips for the laptop user. As I have told that in my first picture, I have shown as the person has attached his laptop screen to the docking station. A smaller screen is attached to the bigger screen. So to visualize the smaller things, he did not have to did not have to go inside the screen and bend his neck. Instead, he can keep his neck straight and he can visualize the he should, and the eye strain will be minimized in this area. The second posture, the lady is sitting on a laptop, or sitting on a chair, keeping his leg 90 degree, raised his laptop, as attached his laptop on a laptop raiser. So if you're attaching a laptop raiser, definitely there will be the no bending of the neck possible. The upper arm, the lower arm angulation is maintained by attaching an external keyboard and a mouse, and the footrest is been kept on the ground to prevent the dangling of the leg. Next, please. Okay. So implementing these ergonomic basics tips, like there are many ways. You can, there are some particular rules like 90-90-90 degree rule is there. Then a new rule is there, NEW new. Then 20-20-20 degree rule are there. Okay, if you are just following these rules, I'm sure that none of you will have this pain or ache, or no, now or nor in future. So this NEW rule, I will just tell you what is NEW rule, what is 20-20-20 rule, and what is 90-90-90 degree rule. Okay, 20-20-20 rule is if you are, next please. Okay, 20-20 degree rule is like if if you are just working on the screen, you need to see 20 minutes to the away from your screen. Okay, 20 seconds you need to see in the greenery object that should be 20 feet away. So that reflects the 20-20-20 degree rule. Next rule comes the new rule, NEW new. The first acronyms like N, it stands for neutral posture. Okay, attaining a neutral posture either from sitting or standing. A neutral posture should include sitting with neck straight, shoulder and upper arm and lower arm should be 90 degrees. Your back should be comfortably attached to the backrest. Your legs should be 90 degrees and feet should be firmly rest on the floor. This is the neutral posture. Either working from the home or from the office, you need to maintain this posture correctly in order to prevent the strain and the pains on the lower back or like a neck pain or the back pain. In order to prevent all this pain and aches, you need to maintain your ergonomical posture. Next comes the E, means that stands for eye and elbow height, whether seated or a standing posture. Okay, the eye and the eye should be 90 degree. 90 degree in the sense it should not be parallel to your head level. 90 degree in the sense you should not suppose if you are just in front of your laptop. Okay, imagine if you're in front of your laptop. If you want to visualize the bottommost line, are you bending your neck to visualize that particular bottommost line or just sitting your eyes down? Okay, so that makes difference. So that's the thing which I want to highlight, like 90 degree rule. The eye level should be 90 degree in the sense it should be straight. You do not have to bend your neck to visualize the bottommost line, or if you want to read the topmost line, you do not have to extend your neck backward to visualize the topmost line. You are just rotating your eyes, right? So that's why I told why you need to keep your eye as a 90 degree. Okay. The top of the monitor should be or slightly below your eyesight level. Next slide, please. W stands for work area. Like there are 3 zones available where you can put your working things either from office or from the home. The primary zone, the secondary zone, and the tertiary zone. Okay. The work area, kept items that are used oftenly in the primary work area are keyboard and a mouse. Okay, I'll be showing in my coming slides what is the primary, what is secondary, what is the tertiary area, and what all things you can keep in that particular area to minimize your breaching activity. In the office, the keyboard and a mouse should be in the primary work zone area, centered with the users and the monitor. So the screen of the computer should be kept in front of you. Okay. So as I have seen in the poll recently, like in my in the last poll itself, the many people are working on the sitting on the couch or sitting or keeping his screen on the dining table and working, right? That's not a properly ergonomically proper way of working, because whichever screen if you are using, whether you are keeping your monitor or whether you are keeping a desktop or a laptop on your dining table, definitely you will be hampering your posture. Definitely you will be suffering from pain and aches, not now but in future, in coming days of. Okay, so just you can in my slides I have already shown, like a person who is sitting on a couch or sitting on the bed and working, a person is standing in a kitchen and working, how he or she can correct the proper way of working. I already shown in my slides before. So just if you are working on a dining table or wherever you are working, that's okay, that's no problem in that. But if you are just maintaining, like if you are taking my example, if I'm also keeping my laptop on my lap and working for 2 hours or 3 hours a day, but I whichever position you can maintain, that's not incorrect, it's correct only. But ergonomically, what it says that if you are just maintaining the proper incorrect posture for more than 4 to 6 hours daily, is the main thing. If you are just maintaining the incorrect posture daily, then only it will hamper your working posture. If you are just maintaining 1 or 2 hours a day, and rest of the 6 days you are not using your laptop or not in front of your screen, that doesn't make any difference to your posture. That doesn't lead to pain and ache. Okay, so that's the thing. If you are just maintaining incorrect posture, and that also if you are maintaining daily on daily basis, then definitely it will affect your body posture. And the third part, like in addition to implement the new principles, following some basic ergonomic tips will go a long way to reduce the risk of injuries and increase the level of comfort without sacrificing the ability to stay protective. Next, please. Okay, so these are the working zones which I have shown in my slide. Okay, the primary zone and the secondary zone, third zone. Up to 18-inch from your hand level. 18-inch, like if you are just extending your hand, that's almost your 18-inch. On that comes almost 18-inch. So keyboard and a mouse should be kept in the primary area, first area. Secondary area, it comes 30-inch from your eyesight level, where you need to reach forward. Okay. The things in this area should include documents or telephone and the document holder or the planner. Third area, on the tertiary area, a distance past arm's reach or over 30-inch away from the body. Okay, in this area, the thing which you are using very are not used periodically. Very rarely, if you are using the things, you can keep that object or the things in the tertiary area, like a document holder or a planner or something like a sketch. Then on any other thing, if you are not using periodically, if you're not reading daily, you can keep that particular thing in the tertiary area. So like that, you can divide the zones and you can make use of your desktop and make it all the clutters clear from the uh, jambling area. Next, please. So the good news is that with all these things, you can prevent all this pain and ache. Like how? There are some preventive strategies which I'll be showing in my slides, like how you can prevent this pain and ache implementing this good ergonomic way. Next, please. The elbow should be at a comfortable angle while hanging at the side from the shoulder. The shoulder should remain relaxed in a lower position while typing. As I told you, it should be 90 degree, 90 degree from the eye level, 90 degree from the upper arm, and the lower arm should be 90 degree, and the 90 degree of the leg and the lower leg position. The feet should be firmly rest on the floor. Okay. If you are working on the laptop or on your desktop, avoid leaning forward at your desk. Maintain a natural S-curve of your spine. Support your lower back. Keep feet supported on the floor. Or if your legs are short and if you are not having proper height, if your height is short, the legs will be dangled in the air. In order to dangle the legs in the air, you can use the footrest. Okay. As I told you that you need to type with both the hands. You need to avoid typing from the wrist itself. You should avoid the typing from the wrist, and you should allow the typing from the shoulder area. Whole shoulder area should move from inward and outward direction in order to type. And the keys which are on the left side, which should be typed from the left finger, keys on the right side should be typed with the right fingers. The keyboard should be slightly lower than the normal desk height. Okay, if it is not low enough, try raising your chair height. Prevent your legs from dangling by using a footrest. And then adjust your chair height. Like I have already explained you how you can adjust your chair height according to your height level, and you can use any kind of chair. If it is adjustable chair, if the chair height is adjustable, you can adjust the chair height. If it is not adjustable, then you can make you keep a cushion or a pillow on the chair, and you can raise your height. Next, please. Next, please. No, previous. No, previous slide. Next. Okay. So you do not have to put a pressure on the keyboard or a mouse in order to type. Just use very light touch in order to prevent the vibration or the pressurizing on your wrist area. Because if you are just you can remember in my previous slides, I have shown the carpal tunnel syndrome, where the person is using a wrist, and if he is pressurizing the wrist and if he is using the mouse, okay, if it's clicking n number of times, there will be some blanching or just some red spots happening in the base of the wrist. That leads to wrist pain or the carpal tunnel syndrome, and definitely it will lead to you need to go for a surgery. So in order to prevent that, you do not have to pound your keys, just use a light touch to type. Use two hands to perform the both left and right side of the keys on the keyboard. Okay. Position frequently used equipment so that you don't have to reach for it. Place monitor. Each monitor should be in front of you. Okay, should not be kept on the right or your left side of the face. Wherever you are sitting, the monitor should be always in front of you. You should not keep your right or left. It should be in front of you in order to prevent the neck strain on the neck pain. Take lots of breaks to stretch and relax. Okay, I've seen that many people are taking breaks, like 1 hour they're taking breaks. Like there are two kinds of breaks available, like micro breaks and a macro break. Micro in the sense like 3 to 4 seconds or 5 seconds break, and a macro break in the sense 30 to 1 hour break. Okay. So have seen like most of the people are taking breaks. That's good. 1 hour break, they are taking a macro break. They are taking. That's good choice they are doing to prevent the pain and it. But in order to with the along with taking breaks, what else you are doing? Doing nothing, right? So I just want to add up in this like take lots of break. Like if you're taking 1 hour break, that's no problem. You can take 1 hour break also. But in that break, you need to stretch out your body, like I'll be showing in my slides, like what all frequent stretches you can do while taking your break. So that will nullify your pain or ache or the muscle which have got tightened while working for 1 hour or 2 hours, or how many hours you are working, the muscles will get constrained and it will get tightened. So you need to stretch out your muscles frequently in order to prevent this pain and ache, which might get arise anytime. Hold the mouse in a very light manner. Keep your hands and arm warm. Next, please. Signal your body provides you. If your neck hurts at work, examine your body position to try figure out what might be causing the soreness. Okay, you need to identify why your neck pain is happening, whether it is to your working style or the bad posture, or whether some external thing might be impacted your neck. Like one example, which if I'm giving you, uh, if you are maintaining a wrong posture during your working hour, okay, you are working suppose like 6 hours, so 8 hours are the minimum working hour. So let's take 8 hours. 8 hours you are working in a office or from the home. Okay, so working from the home, let's take 5 hours. 5 hours you are working from the home. Okay, 5 hours if we are working from the home, that also in a wrong posture, and the muscle will get tight, and at last it will get constrict. And all of a sudden, if you do some activity like bending or raising your arm and lifting, or something, if you are doing any activity while overhead activities, you might get catch or a pull on the particular muscle. So you will go to the doctor, like physician or orthopedic surgeon or a physiotherapist, complaining that I got a muscle catch or a muscle pull while doing that particular activity. You are not identifying the pain or ache which you have maintained for 5 hours or 6 hours in a wrong way of working, and doctor also will not identify that easily that what is the correct way of uh, your what is the initial cause of the pain. You will directly, okay, if you're having the pain or ache, he will give you calcium tablets or the multivitamins tablet or the painkiller tablets, and it will make you free and will tell you, okay, come and see me after 4 or 5 days, and will again assess you. So if the doctors are not identifying the particular cause of the pain, uh, so that reflects the neck pain. So that's what. So if you are maintaining wrong posture uh, and working for more than 4 or 5 hours, that also daily, that will affect your neck pain and the back pain. Are you holding your neck in an awkward angle while you type or talk on the phone? That's what I told you. Like if you are just bending your neck on talking on the phone for longer hours, then that will impact your neck pain and the back pain. If you are experiencing such symptoms like tingling sensation, numbness, or the burning sensation on the hands, or shooting up pain on the arms or the forearm, loss of the strength, if the muscle strength is very weak, or if you're having incoordination problem, this all shows that there will be some nerve entrapment happening in your body, and it will that nerve entrapment that might lead to failure of the nerve at last. So you must see your doctor before it leads to very serious issue. Next, please. Yes, next. Okay. So that this thought. So all we have talked about is neck pain and the back pain and like. So what about headache? Like many office-related headaches are caused by the eye strain. Okay. So what are the precautions? How you can maintain your eye strain in a normal, healthy eyes? Like there are many things. Many, if you just go to Google and type how to prevent eye strain, there are n number of results you can see how to prevent eye strain. But the proper OSHA, according to OSHA guidelines, how you can prevent eye strain, like there are some particular ways without spending much bugs on the external gadgets or external things. You can prevent your eye strain. Like how? Like first of all, dry eyes, then watery eye, then redness of eye, glaucoma, or some blurred vision. These all can be prevented by some simple ergonomical setups and the tips. So, and also the monitor glare will be there. Okay, there that leads to muscle strain, the tiredness of the eye. At last, the muscle fatigue of the eye will be there. So there will be loss of absenteeism in the company or from the work, and the person or the employee will be not in a fresh mood to work very next day, because he or she might be having the muscle fatigue and redness or the tiredness of the eyes. So there will be the uh, ROI, return of investment will be decreased of the company. And at last, uh, you have to leave the job, because ROI has been decreased, so company won't bear the employees to decrease such return of investment for the company. So in order to make yourself very fit and fine, you should have proper eyesight level also, in order to keep, in other than the pain and ache, to keep your eyes also very sharp. So how you can make it very sharp? Like I'll be showing in my slide. Next, please. Like how to prevent eye strain. Okay. So position your monitor combo at a comfortable distance. Like whichever screen you are using, whether if you are using a laptop or a desktop, you should maintain your screen in a proper comfortable distance. Like there should be always one arm or one hand distance. You can stretch your one arm or stretch your one hand forward and maintain the one arm distance and keep your screen in front of you. You should not keep your screen right or left. You should always keep your screen in front of you, okay, in order to prevent the neck strain or the eye strain. Avoid glare. Okay, like there are many things available like indirect lighting and direct lighting are there to avoid glaring. Like suppose if you are using a screen, whichever screen if you are using, back of you, wherever you are sitting on a chair, back of your chair, the sunlight is directly focusing on the your laptop screen or desktop screen. So that will blur your vision. So instead of keep, that's called a direct light. Indirect light are the lights which are coming indirectly, focusing on your screen. Like whichever screen if you are using, just top of the screen there are some lightings available. In the many of the companies I have observed that the lighting, some lightnings are lights are off, some lights are on. Where it should be on, the lights are off. So people, the employees are complaining of eye strain very much, and because of that indirect lighting, because of the direct light, so they might be suffering from the eye strain. Okay. So keep screen clear and of the dust. Look up away. That's what I told. 20-20-20 rule, which I have already explained you. You need to look at 20 degree, 20 feet away from the body. You need to look at a 20 seconds and 20 feet away from the area where you're sitting. Now the question comes: how does the blue light affect your eyes? The blue light, in the sense, the light which are emitting from your screen, in the sense a laptop screen or a desktop screen, or from the a TV or LED TV, which are screen, previously, which are
Just one sec.
yeah, okay, no, previous, okay, fine. So whichever screen if you are using, whether you are fond of using a TV or a LED, there the LED and TV will emit a UV radiation, okay, ultraviolet radiation, that will definitely affect your eyesight. So how you can reduce that particular way? Like next, there are some ample of natural lightings available. Next, please. Next. Okay. So there are natural ample of way lighting available. Like there are two kind of light, as I told you: direct light and indirect light. Indirect lights are coming from the projector. The projector light, it won't affect your eyes, because projector will focus his beams of the light directly on the screen, and from the screen you can able to visualize. So that's called indirect light. If you are just visualizing in sitting in front of TV or sitting in front of LED TV or whichever TV you are using, the direct will be focusing on your eyes, and that will affect your eyesight. Okay, use lamps wherever needed, or like there are lamps available in the market. Use it as a on a indirect light. Keep it on your indirect way of on the upon top of the desktop or a laptop, and use it, and you can work easily. Place your work area perpendicular to windows to reduce the glare. You need to keep your area perpendicular to the windows to reduce the glare which are coming on your eyesight. Keep in mind the monitor should be the brightest thing in the space. Next, please. Next, please.
Yeah, it's not happening. 1 second.
Drink a lot of water and take breaks throughout the day. Like wherever you are working, whether if you are working in an office or if you are working from home, take a lot of breaks in between, like micro and macro breaks. In a macro breaks, only a large break, like 1 hour break, that break only you do the stretching. In a short break, like a micro break, you do not have to do stretching because that's hardly for seconds. You drink a lot of water, like how much amount your BMI should be according to your BMI. You should drink your water, maintain your body hydrated. Try to find the way to stand and alternate job task for a short period of time. Okay, you need to make yourself sit and get up from a chair, whichever chair. If you are working, if you are sitting on a couch or you're sitting on a sofa or sitting on a chair, wherever you are sitting, just get up from that particular area and try to have a walk around that area and come and sit and start working. That will increase the blood circulation inside your body, and that will prevent your pain from your body. So there are several resources I have shown how you can uh, apply these all things. Like, please next slide.
1 second.
There are some many resources available, like computer health matters, online training. That also you can do online training as well, or else you can just download the softwares available on the Google Chrome, like break timer and micro breaks. You can it's available on the Google. You can just download these softwares and you can implement your how much amount you want to take a break. It will just stop your screen and it will beep a sound that a stretch time has come. So that will show some stretching. So you need to just follow the stretching advices which shows on the screen. These are some software available online. And third was the stretches. What all frequently stretches you can do? Like I have shown in my slides, you can have a look. The stretches for the hand area. Next, please. The stretching for the neck area. Stretching for the fingers, the upper arm, shoulder area. Next, please. Stretching for the individual fingers. Stretching for the upper shoulder, upper back. How you can make use of all these stretchings. Whenever you are taking a macro break, a larger break, just do 1 or 2 stretches and it start working. Again, whenever you're taking next break, do 1 or 2 stretches, sit and start working. Okay, so repeat that cycle daily throughout the day. So I'm sure at the end of the day, none of you will feel such pain and ache and will definitely avoid taking medication. As you are not taking medications, that's good. But then also you should just avoid this precautionary way in order to keep your body healthy. Next, please. So this is a computer workstation checklist. Like you need to just you can have a polls, sir.
Not now, Dharmesh. You can
Okay.
continue.
So this is a computer workstation checklist where you can just initially you can just write yes or no wherever it is applicable, and you can able to identify if it is comparing your workings. You can able to know where and when you are getting affected. This is how we used to check if the person is having any kind of pain or ache. Just a checklist. Next, please. There is a ruler scale that's guided by OSHA guidelines. It's a ruler like a rapid upper limb assessment scale. Like there is some ways. There is a software is available as well as there is some manually done. This scale is manually done. Like we need to implement each and every activity done by the body in a particular format. Like if the person is starting from the arms and the wrist analysis, if the person is swinging his arm, keeping his arm in a particular angle, we need to write that particular number in the colored box. Same way, accordingly, we can have a for the lower arm activity, for the wrist rotation activity, for the neck area activity, for the upper back, lower back activity, and we do correlate each and every in the shown in the bar graph in the numerical shown here. You can implement this in a colored box. Finally, at the pink area it is shown, and the blue area in the middle of the bar chart. Below that area it is shown how risky is the hazard. Like if the number is coming like above 6 or 7 area, the person is having very bad posture. So this is called a ruler skill that can be obtained very by doing manually. But it should be counted manually, and it will be the ruler skill reflects the risky posture. There's a computer workstation assessment form where we use in a company. Like if you're using any if you're going and assessing anyone, you are just asking the employee or the person to make the or else if you want to do an assessment at your home itself, we are asking the person or the patient to fill the form. Okay, the patient will only fill the upper portion of the form, like employee name or the company name or the patient name or the time and the areas of working, how many hours if he or she is working, whether he's working in a proper posture, or if he or she is having any medical conditions, what is the height and your weight, and if any additional comments like what all if he or she is having any medical conditions previously. Rest of the thing an ergonomist is filling, like we are filling, like proper workstation, we are just assessing the proper workstation, we are asking the employee to work in a proper way. Okay, and we are assessing and we are marking that we are just picking the number over here, and at last we will be finalizing the result over here. We are just signing in the bottom of the corner of left right hand corner of the bottom, and we are just finalizing, we are just giving a report to the employee, and we are telling the person like, okay, he should maintain the proper ergonomical posture. This he or she should have proper external gadgets should be implemented. Okay, so wherever the defaults are there, we are just correcting by this work session assessment form. Next, please. These are do's and don'ts of the proper ergonomical way. Like do's like you do have the proper height. First of all, you should have proper height of your everything. Like if you are using a desktop or a laptop or a chair, there should be a proper height should be there. Okay, you should use a proper chair if possible. If it is not possible, you can make some adjustment by keeping a cushion or a pillow on the chair and raise your height of the chair at least from your home. You should follow a 20-20-20 degree rule, as I have told you. Okay. So you should get up from your chair and you should walk from your nearby to surrounding for few seconds of 10-15 seconds. Okay. You don't have to go inside the screen and peep inside the screen and bend your back. Okay, while sitting on the screen, you don't have to worry giving up your current chair. Like if someone has misplaced your chair or someone have taken your chair, you don't have to worry the very next day then where my chair has been gone or where it has been misplaced. So what can I do now? Whichever chair is available whichever chair is available by nearby you can make use of that particular chair. You can start working. Don't turn your chair couch into a workstation. Okay, so don't as it is advisable, as if it is not a possibility, make sure that there should be 70 to 80% possibility should be there for the working station area. If it is not possible, then only you go for a couch or a slouching posture. Don't skip lunch and make your body hydrated. Now these are some tips and things which you should maintain to make your posture or make your healthy lifestyle. like keep your daily schedule, eat clean and healthy regularly. Exercise should be also be there. Should maintain a particular distance as coronavirus uh, uh, is in the environment. You should maintain a particular posture. You should regular your shift, like 8 to 9 hours sleep should be there. You should drink enough water during a daytime. Okay? Get started, don't overdo anything, and do physical activity. And socially you should get connected. And the important thing, you should not have junk food. You should have proper regular meal or diet. Next, please. Ergonomic products. These are some products which I have shown in my slide. Like there are many products available in the market, like a keyboard, wrist rest, mouse pad, chairs, adjustable desk, glass screen. So these are some posture which I'm associated with one company. Okay. So if you are just are looking for some external gadgets, you can definitely contact me. My contact details are given in my last slide. If you want any such external gadgets, you can contact me. These are some used some external gadgets if required. Please. These are some proper way of doing the things at home. Proper lifting technique. You can have a look. Next, please. The proper sitting in your home. Should not sit. You should avoid slouching down forward. You should always have a proper sitting area. Next, please. Proper sleep area should be there. The bed should not be slouched down forward. If your bed is slouching down forward, it will impact your lower back. Next, please. These are some other ways of improving your posture. If you are sitting in a car, or if you are sitting in your office or in your home, should not slouch forward. You should sit straight while keeping your backrest locked. If you are going for a work or for any, if you are going for a market or buying a vegetable, you should carry a both the both strap shoulder should be there in your bag. Okay, now you should not hang you on your one side, because if you're hanging it on one side, the pressure will come on the one side, and you will get the neck pain and the back upper shoulder pain very soon. Next, please. The driving posture, the proper usage of phone. Okay, you should sit upright while driving. You should not go in bend your body. You should not bend your neck while driving. As I told you, if you are fond of using phone, use a headphone or use some uh, Bluetooth head speaker to enjoy your phone, and make your wrist or the finger for typing purpose. Should not bend your neck frequently. Next, please. The proper neck alignment while sleeping on your bed. Okay, so you should keep your neck, the pillow should be much bigger and much in a rectangular form that should support your neck and upper shoulder. You should not keep your pillow on your curvature area of your neck. Next, these are some take-home advices for all of you. Okay, as it is coronavirus in your surrounding, what you need to do, like wash your hands frequently, not rub your hands on your eyes. Okay, you should use a handkerchief and your or a cotton cloth to wipe your nose. Okay, these are some basic advices. So if you are having any of your such pain or aches, like if you want to have a consultation with me, you just post your photos or a video of your working style, okay, and email me. I'll be forwarding you. I'll be showing you my email ID. You just mail me stating your number of hours, your photos or video of your workplace. Okay. and I'll be replying you in your 1 or 2 weeks. Next page. So this is the proper ergonomical posture you will like to enjoy. Just have a look on this video, and you can summarize the whatever I said till now. You can have a look and you can summarize the way of it. You can have a look. That's what the video is about, all about the posture, how you can take a maintain the proper posture, how you can take breaks in between, and while taking breaks, what all stuff you need to have. Okay. Next page. Okay, so if you're having any questions or a doubt or any such things, you can type or you can message me right now. You can chat in your inbox and ask me if any of you are having any health issue or doubt, or else if you want to do a consultation, you can mail me as well. I've given my details over here.
Saurabhji, over to you. Saurabhji.
Yeah, thank you so much. It was a wonderful session, Roy. Please explain 2020 concept again.
Okay, the 2020 concept is like you need to have a 20 feet very far from your body. Have a look on the 20 feet far from the body. Always you should have a 20 minutes to have a look.
Yeah, Dharmesh, Dr. Dharmesh.
Yeah. Yes.
Yes, sir. Yeah. There's one more question, like how many, what should be the repetition stretch, I mean stretches repetition, what should be the repetition of the stretch?
Okay, for repetition of, if you are having a much tightened muscle, the repetition of stretch should be like, if you need to do a one simple stretch, hold of a minimal of 30 to 20 to 30 seconds. Each stretch should be hold for 30 to 20 seconds. Okay, and you can repeat it for two to three times.
Okay. What is the ergonomic posture for mobile?
As I told you, like if you're fond of using a mobile very much, you do not have to bend your neck. Instead of, you have to make your hold your mobile in front of your eye line level, and you can type with your hands on your screen, on the mobile screen. And if you are using a phone call, by bending your neck, attach a headphone, Bluetooth headphone or a Bluetooth speaker to the phone, and you can make use of it.
Okay, anyone can, any question, you can unmute yourself and then ask verbally also. You
One
can
second.
ask.
Just one second.
Yes, there is a, what could be the reason of idiopathic leg pain in common people, usually at night, despite the fact they are following their regular routine?
Please unmute Dr. Dharmesh.
Sir, unmute yourself, sir. Okay, I'll answer on behalf of sir. I think sir has some trouble. Look, idiopathic pain, usually it is not directly related to today's topic, but I would let you know there are many more reasons for the leg pain. It's not just the bad posture. It could be anemia. And if what you are saying, the common people, I would consider the age group between 35 and 55. They are mostly from the ladies background. They have the leg pain because of anemia. If they have the pin and needle sensation in the calf, definitely it is due to the anemia. And then if they have more fat mass and lean muscle mass, their anti-gravity muscle, like what you say, calf muscle, basically gastrocnemius and then soleus, that is not able to withstand with the proper weight of the people. That is the one, that is the second reason. Third reason, they don't have the proper what we say, mineral balance. Fourth reason, they don't have protein, enough protein consumption. If there is enough protein consumption, they don't have a proper assimilation in the body. That could be due to the lack of the vitamin. And the fifth reason, of course, they don't have enough water. What Dr. Dharmesh told you to do that. Minimum 2% of the body weight, the water amount is needed very much to maintain your body physiological reactions. So over and above, if you take 2.5% of body weight water, I mean the water of your 2.5% of the body weight water, then definitely it works for you in a proper way. Look, if you are taking more water, your kidney will remove it. You have to visit toilet more number of times and it will actually remove it if it doesn't need more water. So seeing your I mean what we say that seeing your geographical condition, you can take the amount of the water. And
Okay.
these are the common people, they get the leg pain. If you have any other question, you can ask on behalf. I think sir has got some trouble.
Please
So you
unmute.
can ask me. I think
Mr. Tom Riddle has some doubt. Please ask your question, Mr. Tom.
Yeah, what is the correct position if I'm writing with pen and paper or if I'm reading a book?
okay.
If you are writing, can I answer?
Yeah, please.
Dharmesh, sir.
Okay. So if you're writing and on your book or something like that, like how many hours are you a writer? Like how?
No, I just prefer to use a pen and paper. If I'm writing something, I like to write first and then type. So I'll write for like 2-3 hours like that. Or even if I'm writing on a journal or writing anything, what's the correct position?
Okay. So if you are fond of writing, you can use a writing, like you can elevate your user's tool. Like small tables are available in the market. You can keep your you have to bend your neck. That's no problem in that. But for typing or writing, you need to elevate your height of your screen or height of your notebook area.
So how high should it be? Like shoulders, elbows, like what?
Like there is no harm in bending your neck or bending your hand for writing per part, but you need to stretch out your neck part frequently.
Okay.
That will prevent the muscles to get jammed.
No, but you mentioned I should use a stool. So how high should the stool go?
The stools are like small tables are available in the market, like a small tool, like hardly 4 to 5 inch from the ground level. A table
So
like that.
if I'm writing on a desk and then I put the stool on top of the desk, the stool should go up to my neck or my shoulder or my chest or like elbows. Like how high should it go?
Ma'am, actually that you have to do the assessment by seeing your height and weight, height
Yes.
and all. It's not by online. He can't tell you. We have to see like how you have to work and all. Huh?
Yes, ma'am. Because unless if I'm not able to identifying how much level is you're talking about, I cannot tell you like blindly like you need to do this on this. You have to adjust the have to check the height of the your things used.
Yeah. No, I understand you're saying you can't blindly assess, but like you gave tips that are universal. So like for anybody, if they're starting with a regular desk, that based on your tips, the desk height is a certain way, like the keyboard should be below the desk slightly. If we assume that desk, then the stool should be how high? Like if we assume like for any person, like stool
Tool
should
like
be
you are talking
the
about
chest
footrest
or the
or
elbow.
what?
Sorry?
Are you talking about footrest or what tool?
No, like you mentioned, there are stools that you can place on the table to write.
No, or the tool, the one which I'm talking about, if you are fond of using for writing, right? So sit on, you can keep like if you're sitting on a bed or if you're sitting on a chair, okay? There are some tools available in the market that comes only hardly 4 to 5 inch from the ground or from the
No, Dr. Dharmesh, she is asking, she is suppose writing or she is reading somewhere in the table,
Yeah.
Mhm.
and she is asking, shall she will put this whatever you told of the tool should be put in the table or how it is? She's talking about the table. It's not about the bed and all. She's asking about the table. If she's writing something in the table, so she will put the stool in the table itself, or how it is? That's the thing she's asking.
Yes, you need to put a stool on the table, and that stool should be in a tilting position. The backward tilting, how the keyboard comes, like the keyboard, if you are just tilting your back, if you are just raising your backside of the keyboard, the tilt of the keyboard will be backside tilting, right?
Yeah.
So you can make use of that kind of position. You can write and keep it in a diagonal manner, not in a horizontal manner. If you're keeping it in a horizontal manner, you need to keep inside the skin, you need to bend your neck and need to put your fingers into pressure. So instead of that, you can tilt it and make it in a diagonal manner, and backside should be negative tilt.
Okay, so that I'm not bending my neck to see what is there. It's the
Yes,
book
correct.
itself.
If you are making it in a horizontal way, then definitely you need to peep or bend your neck, and you
Yeah.
need to force your fingers for writing. So just prevent it and make it in a diagonal manner.
Okay. Thanks.
Okay.
So anyone else, please unmute and.
Yeah, there is a question from Neha Jain. Teacher come with a neck pain and shoulder due to a lot of written work and reading. So how can maintain the corrected posture? I mean, that is the question. Dharmesh sir.
Okay, what is the
The
question
neck
about?
pain.
Can you please?
Teachers with the neck pain and shoulder pain, how can they maintain the correct posture?
Like what is the basically if we need to identify whether from where the pain and aches are happening, whether he has come for the pain as I have given you one example, right? So if you are working in a wrong posture or because of that particular posture you are having pain or due to some external factors the pain and aches have arisen. We need to identify that first.
Correct, yes.
Because it is
There are
not
some.
it is not particularly due to ergonomically way. It may be due to some external factors.
There is a question that a lot of people they play PUBG games and they watch a lot of Netflix. So what do you say about it? Like what they can do to continue these activities.
That's what, for using phone, I have already shown my slide that they do not have to drop their head in a downward position. They need to lift their neck in a straight way, and if the mobile is down, they can elevate the mobile position in a vertical manner, so that they can visualize in a 90 degree. They do not have to bend their neck for how much hours they were observing, or how much hours they are using a Netflix or the PUBG or whatever.
Guys who want to know about mobile uses, they can use our blog. It's the link will be sent through our academy. I have a wonderful blog on how do you use the mobile, and then like I have corrected more than 30 experts in like IT field because of their like long uses of mobile as well as tablets at their home. So that's a wonderful small blog by me, and academy has a link of that. So within 2-3 days they can share you. Anybody has? Yes, there is a question for you, sir. Again, what posture we can suggest to the dental surgeon during surgery, because they used to complain pain over upper shoulder area?
Yeah, for the dental or for the dentist surgery, or for whatever profession they are, they have to bend their neck, and they have to elevate their hand or the shoulder to keep the toothache or should be pulling activities are happening more on the dentist area, right? So in order to avoid that, they have to elevate the chair height, okay, and minimize. There is no option that to bend their neck. They have to bend their neck for the dentist area, but they can minimize the risk of injury. They can elevate the chair height. They can elevate they can prevent the neck bending by elevating the chair height, and they can perform a surgery or perform the operation or perform the assessment part. There is no 100% surety for the ergonomical way how they can able to 100% cure. They have to do that part. So in order to, they can prevent it by 80%, but 20% still the risk are there.
Okay. Thank you so much, Dharmesh sir. Now, is there anybody because today not just PTs have joined, it's even the few of my patients have joined. Few of okay. Mohammad Asif has a question: how much lux of light required for computer work? Mr. Asif, sir has already detailed about the kind of which kind of light we have to be used, because the most of the light what we have through the LED have a UV light, what we say that that blue light. Basically the blue light have more wavelength, it damages eye, and there's something called macular degeneration that happens because of blue light. So we say people to go with the white light. So you have a lot of things in the market to see. Even in your cell phone, there is something called reading mode, right? If you switch on your reading mode in the night, that's always good. Even on your tablet, you can do that. Even in your computer nowadays, you have a facility to do that. If you reduce your blue light, there is always less chance that you get the kind of what we say that like a temporary blindness, what we say. If you want to experience the temporary blindness in the night, what you do in the night when the you will switch off your like a bed bulb, then you see your mobile with one eye and then continue seeing for about 5 minutes, and then after that you will observe that normally you are not able to see something for some time. That's mainly because of the blue light. So if you reduce your blue light to the lesser wavelength, then definitely this macular degeneration and those things are not a possibility. I mean, something that is how you can save yourself from that. Okay, well, you to reduce the glare, Mr. Asif, you have something called the polarized glass. If you have heard about this polarized glass, kindly you can contact your optician in your area. They will let you know about what is the polarized glass. So if you use polarized glass, definitely the glare factor will be too less. And then of course you should use the reading mode. You have any other question, Asif sir?
So I think Dr. Dharmesh wants to thanks you.
Yeah, thank you, Asif. Yeah, Dr. Dharmesh.
Yeah. So any more questions? As I'm saying, like there are many questions coming around.
Yeah, so we don't have the time to see all those things now. So we'll forward it to you, whatever that comes to the comment box. So the all messages will forward it to you.
Okay,
So
okay.
you have
And
to
you can choose to answer. If you find anything repeated, you can just answer them.
yes, so that you can.
They have your contact number. I think once again.
Yeah, my contact number is given below. So you can contact me by my WhatsApp number or you can mail me.
Yeah. You can drop in the comment box also in one more time, Dharmesh sir.
Chow ma'am, you
Your
can, as I told you, you can switch on to the reading mode. It will read automatically the little yellowish light or little whitish light. It won't be the blue light anymore. Yeah. Yes.
fine.
See you, sir.
Yeah. So next, so thank you, Dr. Dharmesh, for wonderful class and all you have done.
Presentation.
It was very helpful for everyone. And
And
anything?
one more thing I want to share, like those who, if you are interested in attending my upcoming webinar, which is about to coming on 28th of June, that is Sunday, and 5th of July, that is another next Sunday. So I'm just conducting a webinar.
Okay.
So Mr. Sumanjit, can you please share that
Yeah.
info?
So it will be on the ergonomic only. So it's like
Yes.
it's basic of ergonomic. It's a certification course. So this will be a 2-day program, 2 hours. So if you want to know more, please you can contact My Rehab Academy. Then so the number is you can see in the comment box, the chat box. The number will be there, so you can contact there.
Okay. Thank
Okay. So over to Saurabh sir.
Yeah, thank you so much. Many of the participants work from the patient background as well as our normal non-people. You can actually contact us. We are in the city of Bangalore. We have our clinic at more than 5 places. So you can anytime you can contact us for ergonomic consultation even at our clinic, as well as you can choose to call our consultant at your workplace. They will modify your ergonomic part at your home however you want. So like according to your height, according to your body physique, as well as according to your work situation, they'll give you the proper consultation, like how to modify your own desk, job desk and chair basically. And then as the mister has told you, certain like a mouse and keypad or those ergonomic materials, you can always contact us. And anybody has any question personally to me about the clinical part can ask me. See you, sir, I can take question.
Nothing. You can. So anyone has questions, then ask Dr.
Question about the
Saurabh.
clinic or anything like we can help you. We can send our consultant. Even we have facility of sending even at home, at
If you
offices.
have any doubt, please unmute and ask the doubts.
Unmute yourself and can ask anyone. See you, sir, I think you can this you can
Yeah.
put on this information of about your like this clinical part, and then
Yeah, that's fine. Then
or you can send them through the mail also.
let's conclude. Let's conclude then.
I will conclude. Okay, it was a wonderful session by Dr. Dharmesh, and thank you, my Rehab Academy team, to give me opportunity to host it. Thank you so much. You will be getting the feedback link through your uh, through mail. Kindly fill up that link because our team works very hard on the ground to get the best instructor for you. So the feedback link will be coming to you within 10 or 15 minutes. Kindly fill up it and submit it. We'll be waiting for you. Thank you once again, everyone, for joining. Thank you so much. See you, sir. We'll conclude it.
Thank you. Thanks a
Thank
lot.
you.